My name is Kenda Stogdill, and I am a physical therapist here at Clarinda Regional Health Center. I grew up in Auburn, Nebraska, actually, so I am a Nebraska native, go Big Red. And I actually did my undergrad at the University of Nebraska-Lincoln. I did 3 years there where I actually majored in Spanish, and then I minored in gerontology. And I was able to get out of there and get into physical therapy school before getting my bachelor's degree, actually. So I was accepted into PT school prior to getting my bachelor's degree. And then when I graduated PT school at the University of Nebraska Medical Center, I graduated with my doctorate in physical therapy, and they gave me a bachelor's of medicine. I have certifications in actually several different fields. I am dry needling certified, both level 1 and level 2, so I can pretty much dry needle anywhere in the body. And then I am also certified in pelvic floor physical therapy, which means I can treat both men and women for pelvic floor dysfunction. So that can include things like constipation, urination issues, leaking, pain with intercourse. So lots of different things there that require some extra special training. Pelvic floor physical therapy is just like any other kind of physical therapy. Your pelvic floor is made up of muscles and tendons and ligaments. So just like any other part of the body, we can stretch those areas, we can strengthen them, we can improve your coordination. And I really got into this field because it was something that Southwest Iowa just didn't have. People were having to travel to Lincoln and to Omaha to see pelvic floor physical therapists. And to me, that was just unacceptable that people were going to have to drive that far 3 times a week in order to see their therapist. So it's just a very underserved population, and it has been very rewarding to treat this population because you can make just very small changes in their daily habits that really improve their quality of life. And then lastly, I am a certified strength and conditioning specialist. So I always knew that I wanted to be in the healthcare field, but shortly after participating in my first blood drive in high school, I knew that I could never do anything that involved needles or blood. And so physical therapy was kind of the first thing that popped into my head after that. And it really has been kind of a perfect fit because as a physical therapist, I get to spend 45 minutes with my patients 2 to 3 times a week over the span of 12 to 16 weeks. So you really get to know your patients on a deeper level. You get to find out what motivates them, how you can improve their life, and really help them on a deep level. So I really appreciate that about the profession. So this was originally just going to be a 1-year job for me. It was just a way for me to get my foot in the door and kind of get something on my resume. And now I've been here since 2018. I kind of fell in love with it. And it's a small town, just like where I grew up. So I enjoy that aspect of it. Doesn't hurt. I met my husband here, and now we are married and we have our son here. It's just a wonderful little community. The hospital has been so supportive of us in the therapy department. I mean, not many places do you have a state-of-the-art building where you have all of the technology, all of the equipment that you could ever want. And to have that in a small town is just unheard of. So it's been a great opportunity so far, and I can't ever really see us leaving.